Let me start with you, Dr. Patel, on what Dr. Redlener in the last hour described as a false choice. But I think it's one that's setting in, that Americans have to choose between opening up and risking their lives and risking, frankly, the health and well-being of their grandparents or their parents, or killing our economy. What are the real choices that we're facing right now?
No, it's absolutely correct, Nicole. The real choices are, especially with burdens on people to return to work, either physically or even the burden to take care of your children while you're trying to return to some sort of normal work process. The burdens are entirely real, particularly, Nicole, when you think about the lack of testing. We keep talking about testing, but even Florida, which seems to be rejoicing in its, quote, lower numbers, all health experts agree that this is really just the fact that we're still not catching a lot of the cases. So the choice is, how can you do your best as an individual to try to protect yourself against this, knowing that there are still a lot of people out there who are not taking it as seriously, including some of our leaders. And so that is the choice. And we don't have validated treatments that give us enough security, and we're still a long way away from a vaccine. So we're setting up our most vulnerable populations to really have to march into disease and face their own mortality. And that's not trivial.
What do you think the coming weeks hold for us as a country with this patchwork of reopenings, with this daunting new model from Donald Trump's own administration, from the CDC and the Federal Emergency Management Agency, FEMA, that shows the death rate doubling, that shows the infection rate quadrupling, against the backdrop of the president sort of seizing on this message of we have to get out there even if it kills us, and the governors seeming to, in the case of Governor Abbott, having some pause about it, but following up on that edict?
Honestly, it reminds me, I used to do a lot of infectious disease control work in a former life in Central and South America. And in those countries, we saw it was almost neighborhood by neighborhood and block by block. And I hate to say it, Nicole, it reminds me of what we're entering into, where you're all going to have to kind of come together at a very local level and almost kind of shame each other into social distancing or wearing a mask, because there's just not a uniform standard. And even in places where there's orders, we have protests and we have people who don't want to listen to them. So as a physician, I'm relying on the fact that there's still a lot of trust in our frontline workers. And I'm hoping and praying, honestly, that these frontline workers have the respect that they've earned and that people will listen to them. But it's going to be very local.
Ashley Parker, your colleagues wrote this, with several COVID-19 models taking a wrenching turn toward bleaker death forecasts in recent days because of reopening moves in some states. Most Americans say they worry about getting the virus themselves, and they oppose ending the restrictions meant to slow its spread. That's according to the Washington Post University of Maryland poll. So it would seem the president is engaged in a persuasion effort. I think it's upwards of 80% of Americans don't want to do the things they did before the pandemic: eat in restaurants, go to movies, shop in stores. How are they planning on changing public sentiment, and with which messengers? Even I think some of your reporting suggests some acknowledgement that Donald Trump's credibility has been damaged by his turn at the podium.
Well, that's exactly right, Nicole. And I was calling around inside and outside the White House today to try to understand what this new form of the task force may look like. And one of the things you hear is that there is an understanding that they need to change the psychology, is the word you hear, of the American public and the American people, because reopening isn't just about getting the best business leaders to advise the president. It's about consumer confidence. It's, as you said, people feeling comfortable leaving their homes, going out to a restaurant, feeling comfortable hiring a babysitter to come into their homes so they can go out to a restaurant, going shopping. And the tricky thing now that this administration seems to be grappling with is, yes, there is a sort of psychological marketing pitch. But at the end of the day, a lot of what will impact the psychology of the public is actually public health. and medical data. And for people to
Yeah.
really feel comfortable, it actually comes down to the science. It comes down to having enough tests so that you can feel comfortable there's not asymptomatic spreaders in your supermarket. It means coming up with therapeutic treatment so you feel like if you get the virus, it might be unpleasant, but you won't actually die from it. And of course, it involves a vaccine. So the president talks about it recently, at least, as if this is sort of a purely economic decision. But in fact, the public health aspect is tied now more than ever to this sort of whole of reopening approach.
You know, Ron Klain, as Ashley Parker is talking, I'm sort of nodding along because it's exactly right. And you just wonder if that is exactly right. Why was the task force disbanded yesterday and put back on today? Because the president saw that it was popular. I mean, what does it look like to you from the outside?
Well, I mean, I think the problem remains that the president hasn't solved the core public health problem, which is we need to have widespread testing. We need to make sure our medical system's ready. We need to be fighting this disease on all fronts. And from the start, he's treated this as a PR problem. First, he told us it didn't exist. It was going to go away. It'd be like a miracle. He stood up the task force largely to hold press conferences when those press conferences went poorly. Now he was for getting rid of the task force. Now he's for bringing it back. I mean, the fact of the matter is there have been too few tasks and not enough force behind this task force. And I think if he wants people to go out and go to dinner and go to the movies, he has to fix the country so we're not going to die going out to dinner and going out to the movies. And all the spin and all the press conferences, that's not going to change the reality of what people are experiencing. You know, there's a poll out there that shows 1 in 3 Americans now knows someone who's been severely ill as a result of the coronavirus. And sadly, that number is going to grow. And as long as that number grows, the president at his podium is not going to get me or other people to go out and do something that where we risk our lives for a plate of sushi. That's just not going to happen.
You know, and I was talking the last hour to Mark Gay about the plight of sort of the other people on the front line, not just healthcare workers, but people in a slowly reopening economy that have no choice. People who drive buses, people who work on public transportation, people at airport. I mean, we have the luxuries of deciding whether to go out. There are a whole lot of Americans who do not. Where do you think those decisions are made, or do you think they're even considered by this White House, Ron?
Well, we know, Nicole, that they aren't. I mean, I've said from the very first time this started that the phrase lockdown of the economy was a misstatement because there are millions of Americans at work risking their lives so some of us can stay home and be safe. That's a reality. And you add to it now that the president has used his legal authority to command meat packers to go back on the job to produce meat for us to eat. He won't use that authority to command big companies to produce testing kits. He won't use that authority to command big companies to produce the gear that our healthcare workers need to stay safe. But for his allies in the meat industry, he's used that authority to force those workers to risk their lives to process meat. And that just says everything about the priorities that this president has picked to fight this disease. He says he's a wartime president, but he is sending all of us into battle without adequate protection. And we, lost the same number of people last month from COVID as we lost in 10 years in Vietnam. And we're on track to do the same thing again in May. That's not a wartime president.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.